So I'm really pleased to be chairing this session. It looks like it's going to be a really interesting one. And I'm delighted to introduce Martin Campbell from the University of Bristol. And his presentation is really very interesting about community work through football. So to what extent do football-based interventions connect with community social work approach? Now I've asked Martin to say a little bit about himself and the work that he's currently involved in, and indeed his future, which is going to be changing quite soon. So I'm going to hand over to you, Martin, now. People can ask questions in the chat if they want to, or raise their hand electronically and ask questions at the end. Okay, over to you.
Okay, thanks. I'll just start by sharing my screen first, so that everyone can see that. Can everyone see that?
Yeah.
Yeah, okay. So yeah, thank you to the SSCR for this opportunity to present. My name's Martin Campbell. I'm a social work student at the University of Bristol, and I've been doing this research project supported by the SSCR internship this summer, called Community Work Through Football, and I'll explain a bit more about that in the presentation. And so I've done that this summer, and then I will be starting working as a social worker at the end of, after I've handed in my dissertation, and beginning at Bristol City Council in an adult social care team. So that's a little bit about me, but I'll sort of crack on and get on with the presentation. Hopefully should last around 20 minutes, and then be nice to speak with people at the end. So yes, the title of my presentation is Community Work Through Football. To what extent do football-based interventions connect with a community social work approach, and specifically interventions for adults with social care needs? I'm going to talk about how the study was carried out, highlight its main findings, and discuss their relevance to adult social care, specifically referring to sections of the Care Act 2014 and to the statutory guidance. The study had three main objectives: to address the approach which football-based interventions take to supporting adults with social care related needs, to analyse the overlap between football-based interventions and community social work approaches, and to assess the connection between these interventions and social care policy and practice. There are several reasons for studying this area. Previous research has focused on football groups for adults experiencing mental health difficulties, football teams for adults with learning difficulties, football reminiscence for adults with dementia, walking football for older adults, and football programs which support adults in recovery from addiction. Plus, there are sort of wider football-based projects around social inclusion, community cohesion, and anti-discrimination. And these interventions support adults who have eligible needs under the Care Act, but also those at risk of developing social care needs. Furthermore, the literature suggests that there are multiple benefits to physical, mental, and social well-being for people who participate. There is, however, a lack of literature on these interventions and how they relate to social care policy and practice, and that's where this study hopes to come in. So first, it's useful to clarify what football-based intervention means. This study uses the term to refer to community interventions involving activities such as walking football, football-based health and well-being programs, football reminiscence, and other social inclusion type activities. These interventions are commonly run by football in the community schemes connected to professional football clubs, but also by grassroots clubs, charities, and fan groups. Importantly, they're accessed by adults with care and support needs, and also adults at risk of developing care and support needs. This table highlights the core elements of community social work which are used in this study to analyse football-based interventions. BASWA's Code of Ethics refers to local assets, community organisation, and activity for social and political change. Banks refers to three models of community work, including community service planning, community development, which is focused on promoting community self-help and citizen participation, and also community organisation and action. Teeter and Baldwin argue that key concepts like social capital and social goals group work are embedded within community social work. So social capital refers to the networks of trust and mutual support between like-minded people, but also between different groups and different sort of social groups. And social goals group work uses groups to enact social and political change. However, it's important to note that current statutory social work is governed by a far narrower agenda, demonstrated through policies like personalisation, which focus on social issues at a far more individual level. To research football-based interventions, this study sought to gather the perspectives of stakeholders who are involved in delivering them. A qualitative methodology was used to focus on the meaning which stakeholders held about their practice. Furthermore, the study was cross-sectional, collecting data from stakeholders at a single point in time. Maximal variation sampling was used to gather a variety of perspectives within this field. And recruitment was carried out by sending emails to relevant organisations. And 12 stakeholders were recruited via that method. Semi-structured interviews were conducted with each stakeholder, with questions focused on their intervention, the groups they worked with, and the links they had with local health and social care agencies. The majority of stakeholders were at football in the community schemes, connected to professional clubs, but they were also connected to homelessness charities, to a non-profit community organisation, and a fan-led group. Now, they work with a range of groups and communities, including people experiencing mental health difficulties, adults who are with dementia or older adults, and people in recovery from substance misuse. Groups and communities also included refugees and asylum seekers, adults with experience of homelessness, offenders, and military veterans. The thematic analysis pulled out 4 key themes: football as a tool of engagement, football for developing individual well-being, and football for social change, and football's interface with health and social care. First, football as a tool of engagement encompassed the sport's ability to foster shared identity and belonging, the importance of teams and team cohesion, and problematic aspects of the football environment. Quotes from participant 4 and 5 here illustrate the importance of football identities for engaging participants. So participant 4 said, "I would say at least 60% of them are absolutely avid fans, love the football club. So being able to wear our shirt every week, it's hugely important to them. They feel part of the club." And participant 5, talking of their reminiscence programme and specifically the route that participants took to the stadium where the programme took place, said, "To me, the biggest thing is the anticipation. As you walk down the street, it's like the fan experience, that excitement, that hope, will the club win today?" For interventions which involved playing football, team cohesion was also seen as a really important aspect and a build-up of camaraderie between participants. However, problems within the football environment were also identified, including a lack of inclusion of members of minority ethnic groups. Furthermore, football groups for men were sometimes seen to reinforce masculine dominance and hegemonic masculine ideals through the language of banter and ideas around sporting prowess. These practices can be intimidating and exclusionary of participants who belong to minority gender and sexuality groups. Secondly, stakeholders referred to football-based interventions' biopsychosocial benefits. Accessible activities like walking football and chair-based exercises promoted physical well-being. Furthermore, mental well-being was supported through fun activities and mutual support between participants. Social development was expressed through camaraderie, as noted, and also through the promotion of social capital. So participant 1 referred to their health and well-being programme, saying it's not just mental, or physical or social, it incorporates all 3 of them. Both bonding and bridging capital were evident. So Putnam states that the presence of social capital can lead to social networks of trust and reciprocity in communities. Bonding capital based on shared experience is typified by participant 3's quote about their veterans group. They said, "They'll lean on each other, they'll understand their experiences. We do get a lot of personnel with PTSD and issues from what they've seen or experienced. So it's allowing like-minded individuals to help support each other, like peer mentoring really." In addition, participant 9 spoke about their community cohesion work, and that was linked to sort of bridging capital, so bridging across different social groups. So they said, basically, we find various ways of bringing people together from different backgrounds and try and break down barriers using football in various ways. It's not our only tool, but our main tool, I suppose. And that shows how bridging capital potentially has more capacity for social inclusion than bonding capital. That leads on to the third theme of football for social change. Several interventions proactively challenge discrimination such as racism, sexism, and homophobia in their work and through football. Furthermore, interventions used fan activism to bring about greater social equality in their local community. Participant 9's quote encapsulates a proactive anti-discriminatory stance. They said, "It's beyond just racism and football now. It's about sport and equality and community cohesion issues, coaching issues, and Black history." And participant 10, talking of their trust building with local ethnic minority groups and LGBT communities, said, "We've quite deliberately gone into areas where you wouldn't normally expect football supporters to be." However, other interventions were more aligned with the diversity agenda, and that sees football as a space which welcomes everyone. For instance, one stakeholder referred to their participants by saying, "People are people," intimating that they treat everyone the same. This colourblind approach invalidates people's lived experience of discrimination, however, and it shows that work is needed to be done to recognise and break down the barriers which members of minority communities experience when trying to access these interventions. The fourth theme addressed the interface between these interventions and health and social care. Collaboration was seen through referral links with adult social care, NHS mental health trusts, and local GP surgeries. CCGs and local public health agencies also provided funding for several programmes. Overall, stakeholders appeared to be more aware of the links with health services, and perhaps this reflected the physical health focus that many interventions had. However, there was evidence of partnership with social care professionals, such as collaboration with key workers. And this included support workers of people with eligible needs, but also homelessness hostel workers and workers from drug and alcohol services. Participant 12 and 2's quotes highlight this collaborative relationship. So participant 12 said, "It's always great when we have a key worker who is particularly passionate for it, because they tend to be more influential on the people they're working with," suggesting the important role that key workers have in participating in these interventions and supporting the person they're there with. And also participant 2 said, "We guide them to a certain point and actually share that information with their key workers so that they can then maintain the next appropriate step," suggesting that information sharing and collaboration can promote the benefits of these interventions beyond just the programme. However, barriers to integration were also evident, with both health and social care practitioners holding negative and dismissive views of football. So participant 1 reflected these attitudes when they said that they walk into meetings, and this is what they were sometimes met with. They said, especially if they're anti-football, if they're anti-owner of the football club, they can be very much, "What could you possibly benefit to this meeting? And how could you benefit to what we're doing?" Perhaps suggesting a more medicalised view of the kind of role that football can play as a social intervention. And additionally, it's important to note that some interventions, especially those driven by fan activism, work to maintain their independence from state-funded institutions and were very keen on grassroots community organisation forms of community work. Returning to the first key objective of this study regarding the approaches used to engage adults with social care related needs, Football-based interventions utilised the shared identity and sense of belonging which football can generate. They use neutral spaces outside the clinical or statutory setting to engage people, provided accessible sport and physical exercise opportunities through walking football and chair-based activities, promoted both bridging and bonding capital, and showed evidence of collaborating with social care agencies and individuals' key workers. The second objective of this study was to analyse the overlap between football-based interventions and community social work approaches. Here, football clubs functioned as community assets, linking with asset-based approaches to social work. People's interest in football was capitalised on as a strength, which links to strengths-based and person-centred social work. Community organisation was evident where alliances were formed between football fans, community workers and local groups. And bonding capital was promoted in groups based on shared experience, while bridging capital was developed through football-based community cohesion initiatives. For grassroots interventions, activity for social and political change was evident where fans campaigned and protested around local issues, and these interventions also linked with social goals group work. However, as community social work is not part of mainstream social work practice, the application of these findings may be more relevant to a range of different professionals involved in community work, and this could include social workers who are working in the charity sector and social workers practicing in other countries. The third objective of this study was to address the relevance of these interventions to social care policy and practice. And now we speak about the Care Act and the statutory guidance. So the first point of connection here is the principle of individual wellbeing in the Care Act 2014. This encompasses elements like physical, mental and emotional wellbeing. Importantly, it applies to everyone, including those without established social care needs. And in this context, the biopsychosocial benefits of football-based interventions are highly relevant. In addition, football-based interventions can be contextualised within the prevention agenda within the Care Act. Again, the principle of prevention applies to everyone, and local authorities are asked to mobilise local resources in this approach. And as a local asset, football clubs and football groups could be part of this. Within the 3 tiers of prevention, football-based interventions link with primary interventions focused on universal services for healthy living and reducing social isolation. However, there are critiques of prevention, including that it's not been fully politically or economically backed, resulting in cost-saving practices, especially in regards to commissioning, where there's evidence that interventions are being commissioned for their cost effectiveness, leading to a reduced number of interventions focused on areas such as reablement, telecare and falls prevention. Furthermore, asset-based and strengths-based approaches have been viewed as problematic in an era of austerity cuts, as they emphasise individuals sourcing local support rather than challenging structural issues which generate social inequality. Cross-sector collaboration is also another important point of connection. The Care and Support Statutory Guidance recognises sport and leisure as part of a local approach to care and support. However, it offers little detail on how this collaboration should be achieved. In this study, stakeholders spoke of partnerships, but they also spoke of barriers to integration and instances where they wanted independence from services. Sporting Future, the government's most recent sport and physical exercise strategy, also places value on cross-sector collaboration. However, the focus is predominantly on fostering links between sports providers, the NHS and public health. Overall, there appears to be a limited literature on the interface between adult social care and sports providers. Though Disability Rights UK's Get Yourself Active programme is a good practice example. This involved disabled people's user-led organisations, sport and physical exercise providers, and it also involved social care professionals. The programme focused on giving advice to disabled people through local coordinators, involved social workers in training around accessible sport and physical exercise, and promoted co-production. And considering an example like this with very high levels of collaboration, it appears the relationship between football-based interventions and adult social care is yet to be fully explored. So the findings of this study have several implications. Social care initiatives, social care policy initiatives which promote collaboration between agencies and football clubs are needed. Political and economic support for prevention is required, which can promote sport and physical exercise interventions. And there's the need for evidence-based practice, which includes the voices of service users, social care professionals, and members of minority communities who are often excluded from football and the literature on it. In practice, there appears to be a wider range of engagement with sport and physical exercise from people with social care related needs than perhaps is known about. To widen this participation further, initiatives are needed which can promote cross-sector collaboration, co-production to increase service user participation, and address social barriers which are preventing people's access. And finally, it's important to note the impact of COVID on this area of practice. So public health restrictions are in place on sport and other community activities. And this has led to increased barriers for certain groups, especially adults in care homes who may have attended reminiscence programs, older adults who may have accessed social activities or walking football, and also the economic impact of COVID-19, which is concerning, especially for clubs in the lower tiers of English football. And this may jeopardise the funding for some of these interventions. So it's important to consider that. These are the references from this presentation. And lastly, just to say thank you so much for listening, and thank you to the SSCR for funding this research. And I'll stop sharing my screen now so that you can see.
Great. Thank you, Martin. That was a really clear presentation. I think we're all kind of silently clapping. That was a really clear presentation, and your slides were great. I guess they'll be available to people who want them, and of course the recording will be available. So we've got a little bit of time for some questions, and you know, people can raise their hand and ask, or I don't think there's anything in the chat at the moment. So Martin.
So firstly, just say to Martin, that was brilliant. I mean, it's really good, great presentation, great piece of work for our internship. That's really impressive. And it's good to see Putnam from time to time. So different types of capital, social capital, that's good. Just my general question, I mean, I think it'd be really useful. So I think one, it'd be great if you can make that available somehow to people, because I think lots of people interested in those wider forms of community intervention and how they can be supportive. And you've clearly covered the literature really well. So that would be great. My question to you is, you know, is there something special about football? What is it something that football is, that there's a particular spark that it creates or something? So that's my question.
You stole my question, Martin.
Yeah. I think that's a really interesting question, in that was probably my reason for researching this area. As a football fan, not a very good football player, but my perception that there is a special connection to football. And I think that is true, and definitely there's evidence of the real localized identities and sense of belonging that connection to a club can bring. But I think the more that I read about it and the critical views that people bring to that area, it made me sort of realise that it's also an incredibly exclusionary sport for minority communities. So on the one hand, it has sort of special significance for lots of white men predominantly who are able to access these spaces, but there's still you know, lots of barriers for people from minority gender and sexuality groups and ethnic minorities for attending these interventions, and football more broadly as well. So I would say yes, but I would say that you know, the people who are able to enjoy that unique sort of sense of identity that it promotes is perhaps limited to a certain group of people.
Thank you. Is there another question? I think like most people have got their Joe, and then Madeline after Joe. You're on mute.
You'd think I'd never been on a Zoom call, wouldn't you? That was great, Martin. I'm sure, like Martin, that it would be worth writing up. And I think practice the Baswa Journal would be really interested in this. It's not as highfalutin as some journals, and is quite accessible. So do think about that. I wanted. I'm not from a football city. I'm from a rugby city, so I think it'd be much the same said about rugby. But I wondered if you wanted to think also about the negative aspects of football, which is its dominance by the gambling industry. We're doing a lot of work on gambling at the moment and social care, and how its tentacles have come into all areas of life and are pursued by the gambling industry, and football are just like that. I went to a recent World Social Work Conference that was held in a gambling organisation's football stadium, and it was just so in your face. And I think as social workers, they face a lot of ethical issues really about do you want to bring people into this very controlled gambling environment with all the risks that takes. And I haven't seen any literature on that, but I think it explains some of the ambivalence of social workers about introducing people to community casinos, really, isn't it? About just the messages that you go, everybody's got it on their sports, the venue is branded, and it's very difficult, I think, for people to manage that in their professional life about selling that to people.
So do you want to respond to that, Martin?
Yeah, thank you. That's a really interesting point, which I hadn't actually thought about, but I think it highlights a wider point about the more institutional forms of community work which are done by professional football clubs. So the ones who would be connected to clubs sponsored by gambling firms, but also clubs that would be funded by repressive regimes who are sports washing and cleaning their image through football clubs, and lots of other sort of dodgy affiliations that clubs have. And I think you make a really good point that actually as social workers, if we're getting involved with promoting people into having this kind of community sport, we have to recognise where there are real ethical dilemmas with that. So especially with human rights abuses that owners of football clubs are involved with, connections to gambling companies. So yeah, I think the positive things that I found from this study was from some of the more grassroots kind of style community organisations, which were not sort of implicated with these kind of quite problematic elements. They were perhaps able to focus on community work at a far more kind of ethical level. But yeah, thank you. That's something that I'll definitely look up in terms of the links to the gambling industry.
Sure. So Madeline.
Hi, Martin. That's really interesting. It really gives us a sort of idea about how people benefited from being involved, and there were really good quotes. I was wondering whether you had any thoughts about any implications of the qualitative work that you've done for possible more quantitative evaluation of these type of interventions.
Yeah, I think the good quantitative work that's been done so far has predominantly been in sort of the health and wellbeing interventions that are done through football, where people have done surveys around people using wellbeing scales and things like that. So if I was going to do a study on a specific intervention or set of interventions, that would be something I would think about. And also referencing the literature to people also thinking about social network analysis of football-based interventions, bearing in mind the importance of social capital to try and measure some of the sort of the strength or quality of the connections that people build up with each other, although that may not be really quantitative. But yeah, thank you. That was a really good question.
Yeah, I was just wondering whether you maybe uncovered some aspects of benefit that might not be necessarily reflected in those sort of measures, and that might, I mean, just something to think about. You don't
right.
About it,
yeah.
Future.
No, sorry, I think I misunderstood the question. Yeah, no, I think certainly the programs which built up links with local groups and actively tried to break down social barriers or had a social justice element to them, that's stuff that's not recorded in other research, which is from health predominantly, or from nursing or psychology or social policy. So that was something that I was particularly interested in, is trying to bring that within the term football-based intervention, because some people would view it in a more narrower sense, that it needs to be just playing football, and how that affects your physical health and mental well-being.
Sure. So we've got a
Whereas
question.
I was kind of using the term
Sorry.
No, sorry. I was just I was using the term football based to encompass a broader range of things, which involve not just playing the sport, and getting involved in community activities. And I think that's the stuff that maybe this study captured, that perhaps other ones which are use more quantitative measures or a narrower kind of look at it probably didn't pick up on. Sorry, I didn't understand the question the first time. I wasn't listening properly, but I got it second time.
Okay.
My
So
fault.
there's a question from
No,
Karen.
not yours.
Hi, Martin. Thank you. That was really interesting. And funnily enough, I've just been invited to be a co-op on a bid around football, about which I know very little. But I suppose that for me, there's a question about the kind of analysis in terms of gender and also ethnicity, in particularly in relation to kind of social capital. You know, because obviously football is traditionally very gendered, and that has maybe both positives in terms of social capital, but it also has negatives in terms of what you talked about in relation to hegemonic masculinity. And I wondered really whether you've done any fine-grained analysis of those aspects, because they've obviously got social justice implications.
I think there were three interventions within the sample, one which was a women's football group, and two which ran a women's group of their health and well-being activities. But other than that, it was predominantly either male focused or predominantly accessed by men, and within that predominantly white men. And I think it would be really interesting to analyse and study some interventions where there is more of a mix or a diversity of participants. In this study that I did, the main ones were the community cohesion work done by grassroots interventions. Excuse me, and they did do a lot of work with local minority ethnic groups, and obviously had a women's football group. But in terms of some of the stakeholders' awareness of what the issues might be around sort of gendered accessibility to their sessions, I don't think it was necessarily a massive focus for some of them. I think they were very much in the idea that to reach men, in their words, you needed to use football, and that was kind of the whole premise of the intervention. And I think they used that, but perhaps didn't quite or weren't openly reflective of that in interviews with myself about the issues of excluding other people, and the ethical issues with that, I think.
And so it was partly whether you picked up differences in the nature of the social capital.
Difference in the nature of the social capital.
Between men and women, or between the different ethnic groups, and whether
I think
kind of analysis really in that respect.
Yeah, I think in the community cohesion interventions, which was proactively focused on that, the strength of the relationship between the community workers, people in that intervention, and local groups were very strong. So one example was a community cohesion initiative in a city in the northwest, and they actually held sort of tournaments against other teams who had similar sort of affiliations, and also they facilitated sort of community days and community cohesion events, watching football matches from the 2018 World Cup. So I think the strength of those relationships, which they sort of maintained continually through football matches and through watching football, were really strong. So I think that's a good example of where there were strong links.
Okay, that's interesting. Thank you.
Right. So are there any is there one final question? No? Okay. I mean, I think it's a really great piece of work that you've done, and at this stage of your career. And I certainly look forward to seeing it published, and also what you're thinking about next. So yeah, really well done. I really enjoyed it. And thanks everyone. Thanks for some interesting questions. I'm sure Martin will be happy for contact if anyone wants to know more, but well done. Thank you.
Thank you very much. Thanks for all the really insightful questions. So thank you.
Okay, great, thanks. Bye-bye, everyone.
Bye-bye.
Bye.